Well, she is a renowned expert in the field of female sexuality, and today we are lucky enough to have Dr. Jennifer Berman in our studio to talk about that dreadful word, menopause. Welcome to the show.
Thank you. Thanks for having me.
Yeah, so you're in town and you're going to be at an event tonight. We're going to talk about that in a few minutes, but let's start off with sort of what menopause is.
First, I want to say that it doesn't have to be a dreadful word, actually, because it's a time where women can be free with their bodies, not have to worry about pregnancy, can start to feel more comfortable in their bodies or feel more self-secure in who they are and what they are. So it is a time of re-exploration, so to speak. But the definition of menopause, if you want to, what it means is the cessation or stopping of the menstrual period for at least 12 months. So once that happens, that means your ovaries are no longer producing eggs and you're technically menopausal.
Okay. So, I mean, once you get, you know, I'm hoping I'm using the terms right, you get through menopause or you get to the actual menopause stage itself, it can be a good thing, but you always hear about sort of going through it and getting started in the hot flashes. And
the going through it can be the difficult part, but all women experience that differently.
Right.
Technically, the perimenopause starts when a woman is late 30s, early 40s. Menopause, which is what you're talking about, when women start to experience hot flashes, night sweats, mood swings, fatigue, weight gain, low libido,
that doesn't sound dreadful to you.
dryness. But the good news is there are treatments available, and we're going to be talking about them tonight at Fascinations, and that's, you know, that's the exciting thing. And then postmenopausal is after she's no longer experiencing those acute symptoms of hot flashes and night sweats. However, the symptoms that linger at that point are usually the sexual function ones, be it low libido, lack of sexual desire, and vaginal dryness. And oftentimes women will complain about a change in their ability to achieve orgasm.
Now, is it sort of hereditary? Like if, you know, if my mother went through menopause at an earlier stage, does that mean that I'm going to start to go through it at an earlier stage?
That's a good question. Women tend to menstruate at around the same time that their mothers did, and they tend to go through menopause at the same age as their mothers did, and they tend to experience menopause in much the same way as their mothers did. So that's a question, you know, that women should ask their mothers.
Right.
You know, how,
and I've, you know, watched my mom go through it, so the good thing is she's gone through it, or going through it, and
she's floating through.
She's floating through, and she found a way to get through it. Okay,
well, you're good.
So the early stages of menopause, I mean, I guess some women out there could just be thinking, well, my period's been off for, you know, for the last 3 months. How do you know when that's exactly what you're going through?
Well, that is how it starts, with menstrual irregularity. Oftentimes they become worse symptoms of PMS. Sometimes they'll become
that's just great for all the men in our home.
Sometimes there'll be very subtle signs, but that's the time to really initiate treatment, because if you are able to treat those symptoms, it can delay the onset of full menopausal symptoms, and you know, alleviate the ones that you have. So there is a growing movement towards early intervention rather than waiting till you're full on, you know,
right. Why would you want to go through that?
Yeah.
Well, let's talk about the early treatment. I mean, is it, you know, is it something you're going to have to start taking pills every day? Is it, what is it? What is the treatment?
Well, it depends what the symptoms are. The treatment now for women that are symptomatic involves natural hormones or hormone replacement therapy, depending upon what her symptoms are. Oftentimes, moodiness, headaches are estrogen related, or imbalance of estrogen. Oftentimes, worsening symptoms of PMS, bloating, fatigue is progesterone related. Women will also complain of loss of libido, you know, sometimes throughout the entire month, sometimes at different phases of the month. That's testosterone related. So we've started to individually tailor treatment to meet each woman's needs. Not each woman is exactly the same. Not each woman gets the exact cookbook. This is how it used to be done. Every woman got Prempro. It's not like that anymore.
Hormone imbalance. I mean, do all women sort of experience the same type I think you just answered it, though.
We all
Everyone's different.
experience, you know, as our body, fluctuations in our hormones, and it's really not so much a lowering, it's the ups and downs
Right.
of estrogen that causes the moodiness and the irritability and the.
I could have been going through this since I was
You
about
probably
10.
are, and some more than others, and the goal is to get you to stabilize and sort of not be estrogen dominant or progesterone dominant, but to have equal sort of balance. It's all about balance levels.
So you think, you know, 1 or 2 months of your period being a little different, or just feeling some of the symptoms, now it's time, okay, let's just go to the doctors and they'll do some type of a blood test or something?
What it involves is a blood test to look at your ovarian hormones. Oftentimes, the adrenal gland hormones can be affected because as we are working women, moms, there's a lot of stress in our lives.
But it's an easy thing to find out if you have it, if you're going through it, and get it fixed.
Okay. But you have to ask the right questions.
Right.
So.
Well, that's why you're here.
That's why.
Because we want to know the questions. Well, let's talk about this event. You are going to be out there tonight, sort of hands-on with everybody,
Right.
and helping them out at Fascinations. What is the name of the?
It's let's talk sex.
Okay.
And I'm really excited about this because you know I am a doctor,
Right.
a urologist, and you know I've just started to. Take baby steps into this realm of bringing erotic toys, products such as Wet. There's a product called Wet, which is a fabulous lubricant, by the way, into the mainstream. So as I'm venturing into the erotica, I'm bringing out sort of my picks, my ideas, my thoughts, my interpretations, and I think that there's a role for that. Other than we've been talking hormones and drugs, there's a role for sexual enhancement products in everyday women's lives.
And I bet there's a lot of people that are sort of embarrassed, or they don't know who to ask, but you're going to be answering all the questions tonight.
Right. And taking the stigma out of it.
Fabulous. Thank you so much for coming on the show.
Having me.
We are going to have all of the information on our website so that you know which Fascinations to go tonight. It is in Tempe, but again, all of that information is going to be on our website. Thank you again.
Thanks.
All right.